Hi everyone, I'm Dara. We all know that exercise is good for us. It reduces our risk of cardiovascular disease and diabetes, and decreases blood pressure and cholesterol. However, the benefits of exercise on people with intellectual disabilities is overlooked. Specifically, I'm going to focus on Down syndrome. People with Down syndrome have a higher chance of getting additional health risks, and to incorporate exercise into their daily lives will greatly benefit their quality of life. I'm going to start with explaining in general what Down syndrome is. Down syndrome is a birth defect, and it is the most common chromosomal condition. There are about 6,000 cases of babies born with Down syndrome every year in the United States. The basic biology of the nucleus of a cell is that it normally contains 23 pairs of chromosomes. So in total, that's 46 chromosomes. And those chromosomes contain all of our genetic information that we inherit from our parents. Down syndrome is a genetic disorder that is caused by an extra copy of chromosome 21. Down syndrome is accompanied with many physical symptoms, the common symptoms being a flattened face, shortened height, upward slant of the eyelids, and poor muscle tone. Along with the physical symptoms, there is a chance of mild to moderate cognitive impairment. The intellectual symptoms include difficulty learning, slow speech development, and impulsive behavior. These are not the only symptoms of Down syndrome, and every individual with Down syndrome could have slight variations of the symptoms they present with. Down syndrome can be diagnosed in two ways, so it's either prenatally or after birth. The chances of a baby being born with Down syndrome increases as the mother becomes older. So older women that are pregnant have a higher risk of having a child with Down syndrome, and doing a prenatal diagnostic test on them can predict if the child has Down syndrome to almost 100% accuracy. However, these diagnostic tests are offered to all pregnant women of all ages. A test can also be run after birth if the baby presents with common physical symptoms of Down syndrome. They run the test by taking a little bit of the baby's blood and getting a karyotype chart to see if there are any abnormalities in it. With Down syndrome comes a predisposition to many health risks. Many of these risks are inevitable due to the circumstances of the disorder. However, some of these risk factors can be regulated through regular exercise. Obesity is a problem among children with Down syndrome because they are not getting the proper amount of physical activity, they have diets that are less nutritious, and a lower energy expenditure at rest. Obesity itself is a problem, and it can cause a cascade of different health problems such as diabetes, sleep apnea, and heart disease. Also, people with Down syndrome have a 26% lower bone mineral density when compared to people without Down syndrome. And there's a correlation between aerobic fitness and bone mineral density. The relationship is because the more someone runs or jogs, they're constantly forcing their legs to hit the ground, and that impact strengthens their bones. People with Down syndrome also have a lower VO2 max, which could be due to many things, but one of the main explanations is because a lot of people with Down syndrome have a heart condition which prevents the heart from increasing heart rate during exercise. They also have poor exercise economy, which means they use more energy to do less work. The reason for their poor exercise economy is mainly due to their low muscle tone and loose ligaments, which those are physical symptoms of Down syndrome. There was a study done that looked into the performance of daily life tasks by people with Down syndrome, and if their performance was affected by their limited strength and aerobic capacity. The setup of this test involved 35 participants that completed an isometric test, a VO2 peak test, and 3 functional tasks of daily living. An isokinetic strength test was done on individuals' legs using an isokinetic dynamometer. This device measured the strength of the knee extensor and flexor muscles of the leg. We briefly discussed this device in class, but basically it's a machine that can isolate a specific muscle group to see the strength of it by looking at the force and speed output. And the participants are tightly strapped in to prevent compensation from other muscle groups. A peak VO2 test was also performed on a treadmill to look at the participants' aerobic capacity. The grade was increased by 2.5% every 2 minutes till it reached the maximum grade of 12.5%. Along with that, the speed of the treadmill was increased by 1 mile per hour every minute. Similar to what we did in lab, they had equipment to measure their oxygen consumption and a heart rate monitor to measure heart rate. This test continued until the participant physically couldn't go anymore. The 3 functional tests were chair raises, going up and down the stairs, and a gait speed test. The chair raises measured how fast the participant could go from resting on the backrest of a chair to an upright body position. It also measured how fast the participant can sit and stand from a chair. The stair test looked at how fast the participant could go up 10 stairs and then how fast they could go down 10 stairs. Then the gait speed test looked at how fast the participant can walk from one spot to another, and the distance was about 7.6 meters. The overall conclusion from the test said that physical fitness does affect daily tasks, and for people with Down syndrome, their limited strength and aerobic capacity can negatively impact their ability to do daily functional tasks, and that it's recommended that people with Down syndrome take the proper steps to improve their physical fitness to enhance their independence so their quality of life can be better. So how exactly do people with Down syndrome benefit their quality of life through exercise? There was a systematic review done that looked into the health benefits of exercise therapy for patients with Down syndrome. As I talked about earlier, people with Down syndrome have a higher risk of becoming obese due to many factors. One of those factors being low physical activity. By increasing their aerobic fitness, they will have a lower risk of becoming obese and developing the health consequences that are associated with obesity. Also, by participating in aerobic exercise, there will be a decrease in arterial cell wall damage and lipid peroxidation, which that's basically the oxidative breakdown of lipids like in cell membranes. Also, it will help facilitate vasodilation in blood vessels, which will help enhance blood flow through the body. So overall, these physiological responses will decrease the risk of cardiometabolic problems. A physical symptom of Down syndrome is low muscle tone. When people with Down syndrome participate in resistance and strength exercises, they're increasing their muscle tone along with improving their proprioception, which that's basically being aware of your own body posture and movement. As they strength train, their balance, agility, and posture will also improve. Also, resistance training can also benefit their cardiometabolic profile by increasing their sensitivity to insulin and helping patients with diabetes. Also, a little side note that I found interesting was introducing patients with Down syndrome to Wii games can also increase their lower limb muscle strength, aerobic fitness, and proprioception. So in class, we talked a lot about the American College of Sports Medicine and their recommendations of exercise. The ACSM has specific recommendations for people with intellectual disabilities and Down syndrome. The recommendations for people with Down syndrome is almost the same as it is for healthy people without Down syndrome. The main focus of their exercise should be cardio and resistance training. To increase their cardiovascular fitness, it is recommended that they do aerobic exercise for 150 minutes a week, and it is encouraged that they exercise 3 to 7 days a week. So 3 days can be moderate to vigorous, and then the rest can be light. Specifically, for people with Down syndrome, they should begin their programs walking and ease that into a jog, and then eventually turn that into a run. Another good alternative of aerobic exercise is swimming. For resistance training, they should begin with light weights so they can get used to the movement and slowly ease into heavier weights as they start to get the hang of things. Also, it's recommended that they use machines, and I think that's probably due to the fact that machines help with stability and form. And also, they should focus on all of their major muscle groups. People with Down syndrome should be closely watched as they begin their exercise program in order to ensure safety and prevent an injury when they begin resistance training. For flexibility, patients with Down syndrome are not recommended to work on their flexibility like the general public is, and this is because they have loose joints and this can possibly cause an injury. Just like everyone else, there are some special considerations that need to be taken into account when exercising with people with Down syndrome, such as their low aerobic capacity, their limited ability to increase their heart rate, their low muscle tone, and their unstable joints. To conclude, I want to say that people with Down syndrome are predisposed to many health problems, and exercise can decrease their risk. However, exercise is important to everyone in order to live a healthy lifestyle. Exercise must be incorporated into everyone's daily lives in order to truly see the benefits.